Hello, my name is Derralynn Hughes. I'm Professor of Experimental Haematology at University College London and work in the Lysosomal Storage Disorders Unit at the Royal Free London NHS Foundation Trust. I'm going to review some of the research highlights relating to Fabry disease at the WORLDSymposium 2021. Our learning objective is to describe the latest research related to Fabry disease, better understand the condition and to better manage people with Fabry disease. World 2021 was quite different to any of our previous symposia. The World meeting is an annual meeting focused on lysosomal storage diseases. It usually takes place as a 5-day live event in February each year. However, this year, of course, due to the pandemic, it was a virtual meeting, and so quite different in its relationships of the speakers and the meetings and the general discussion. Since Fabry disease requires a team approach involving all areas of the multidisciplinary team of cardiology, nephrology and neurology, then we felt it was important to discuss some of the world highlights related at the virtual meeting so that the wider team could have access to this information. There were a number of presentations related to Fabry disease, and we'll start with some new insights into the natural history that came from the Fabry Outcome Survey. FOSS is now 20 years old and has recruited more than 4,000 people with Fabry disease from 144 centres throughout the world. Data of that whole cohort over 20 years shows a small decline in the renal function in the eGFR slope and a small increase in the LVMI slope over 20 years of enzyme replacement therapy. We also look at the mean age of symptom onset versus diagnosis, and it still shows us that symptom onset occurs many years before diagnosis, and therefore the opportunity for making an earlier diagnosis and an impact through earlier treatment remains to be yet fully optimised. So our conclusions are that FOSS provides insight into the natural history, into treatment efficacy, but really does show us that there is an opportunity to both diagnose and to make treatment earlier for patients with Fabry disease. Equally, there were studies looking at the impact of starting late of enzyme replacement therapy on Fabry disease. This study from the multidisciplinary team at UCLA looked at various aspects of physical health and quality of life in 26 patients receiving enzyme replacement therapy. Most of the patients had common symptoms for Fabry disease, including neuropathic pain, cardiac involvement and angiokeratomas. Others had some more uncommon findings such as pulmonary involvement, lymphedema and hearing loss. The study found that enzyme replacement therapy, as expected, improved levels of plasma GL3. But of note, in those patients who started enzyme replacement therapy later, the decline in renal dysfunction and health-related quality of life continued. So what are the opportunities for earlier diagnosis of Fabry disease, which might therefore help us to start enzyme replacement therapy or other Fabry-specific therapies more punctually? Earlier onset Fabry disease or classical Fabry disease may be easier to diagnose, in fact, by consideration of that classical triad of symptoms of angiokeratoma, hyperhidrosis and corneal opacities. Later onset Fabry disease is often associated with involvement of a single organ, and in fact therefore may not declare itself until there's already significant organ damage, for example renal dysfunction or cardiomyopathy. And therefore even here there's a need to reduce the time to diagnosis from the start of organ manifestations. We note 3 possible studies using technology to try to instigate an earlier diagnosis for patients with Fabry disease. The first of these studies used routinely acquired hospital data. 2 million people coming to one of the UK hospitals. The team looked for patterns of symptoms which might allow early diagnosis of patients. The second study also looked for patterns such as pain as an early symptom of Fabry disease in the German pain registry. In the final study, we note that there was an artificial intelligence algorithm designed to compare data from nearly 5,000 patients with Fabry disease with over 1 million patients who did not have Fabry disease. And this AI model appeared to create an algorithm which So in the final study, a model of artificial intelligence was developed, comparing data from over 5,000 patients with Fabry disease with over 1 million patients who didn't have Fabry disease. This AI algorithm appeared to create a model with a high diagnostic efficiency, with up to 180-fold enrichment in the identification of patients who had Fabry disease. Once a patient with Fabry disease is diagnosed, there's often family screening, cascade screening, which leads to the diagnosis in other patients related to the index case who may not themselves at that stage actually have symptoms which might be indicative of treatment. And therefore it's important that those patients are fully evaluated and followed serially, perhaps over a number of years, until they meet a criteria for Fabry-specific treatment. It's therefore important to understand the natural history and the staging of some of the manifestations of Fabry disease. In this work from Augusto et al., looked at the staging of cardiomyopathy by imaging through cardiac MRI of the hearts of patients with Fabry disease, suggesting that there were a number of stages that a patient might progress through, therefore giving us insights of possible early features on which treatment might be initiated. They describe myocardial blood flow, global longitudinal strain, T1 and T2 relaxation times. They found that patients who had low T1 generally had a higher LVMI and other changes in the ECG, whereas patients who had normal T1 did sometimes have microvascular impairment and subtle T2 elevation and other different changes in the ECG. On this basis, they predict various stages of cardiomyopathy. A pre-LVH stage where they could detect storage, the storage stage followed by left ventricular hypertrophy and inflammation, and then followed ultimately by fibrosis and impairment of conduction function. In addition to making an earlier diagnosis and allowing earlier treatment for patients with Fabry disease, we witness a developmental programme of new treatments for patients with Fabry. Linnart et al. Presented data from the BRIDGE study, which is a study looking at switch of patients from agalsidase alpha to a new pegylated enzyme replacement therapy called PEG uniglycidase alpha. On average, the patients were 45 years old. There was a mixture of classic and non-classic patients. And the patients had an estimated GFR annualized decline of minus 5.9 mils per minute. And that was roughly balanced between males and females. After switching, you can see that in many patients, the rate of decline actually decreased. And you can see here the overall rate of decline decreased, and also in males and females. Another modality of treatment which is currently being explored is gene therapy. This has been used either as ex vivo or in vivo gene therapy, and there were a number of different presentations related to gene therapy for Fabry disease. There were two presentations, one ST920, looking at in vivo gene therapy with AAV2/6 vector, and another one by Thomas et al., an ex vivo gene therapy using AVR-RD01 in a lentiviral construct, which is given to autologous stem cells, which are then transplanted into the patient. We look forward to seeing further data on both of these studies as the treatments mature and we become to understand further the role of gene therapy in the treatment of patients with Fabry disease. So finally, in this year of the COVID-19 pandemic, I'd like to discuss two studies which relate to the impact of COVID-19 on patients with Fabry disease. The first is a study presented by Derralynn and colleagues who looked at real-world experience of 22 patients with Fabry disease who had COVID-19 infections. Sadly, 2 patients died. Both of these patients had serious cardiac and renal problems associated with Fabry disease. They put together a schema which showed that many patients have low risk of COVID-19 reactions, and these are the patients who essentially don't have organ involvement. Whereas for those patients who have organ involvement in terms of heart and kidney problems, they may well have a high risk of COVID-19 consequences and therefore need to take appropriate precautions in terms of self-isolation and possibly vaccination, for example. COVID has also had an impact on clinical trials. For those patients who are already enrolled in a clinical trial, it's been important that we've been able to continue with regular monitoring and implementation of the study. For many studies, we've changed to remote visits. Fabry et al. Looked at the impact of COVID-19 on the lucerastat study of oral substrate reduction therapy in Fabry disease. And they looked at our ability to change to remote visits with oral treatment, which was shipped to the home. In this study, the data analysis did not reveal any interactions between lucerastat and frequently used COVID-19 medications. So in conclusion, a wide range of clinical studies in relation to Fabry disease were presented at World 2021. This ranged from a discussion of 20 years of enzyme replacement therapy treatment through FOSS, through natural history data collection, and the registry collection of patients receiving enzyme through that study. We've also seen improvements in diagnosis and increased understanding in the role of early diagnosis and early treatment. We've seen studies evolving on the use of chaperone therapies and enzyme treatment, but also now studies on newer treatments such as enzyme replacement, new substrate reduction, and gene therapies in development. There were also presentations this year around comorbidities and staging of Fabry disease, and also the impact of COVID, not only on the treatment of patients with Fabry disease and on their outcomes, but also on our delivery of clinical trials. And as with all storage disorders, it's important to note that the team approach to treatment is all important. Thank you for your attention.